Good afternoon, everyone, and welcome. My name is Annette Johns, and I'm the Associate Director of Policy and Practice with the Newfoundland and Labrador Association of Social Workers. I have the honor of being the moderator for today's education event, which explores the informal use of information and communication technology as an adjunct to traditional face-to-face social work practice. This webinar is being brought to you today by the Newfoundland and Labrador Association of Social Workers and the Canadian Association of Social Workers. It is also a collaborative effort with the Munn School of Social Work and their work through the Advancing Practice Together initiative with the Department of Children, Seniors, and Social Development. I'm excited to say that we have over 170 social workers from across Newfoundland and Labrador tuned in today. Before I introduce our presenter, I just want to go through a few housekeeping details. The webinar presentation will be approximately 60 minutes, followed by a 30-minute questions and answer period that I will moderate. Please note that the recording of this webinar and the PowerPoint will be available on the NLASW website under Continuing Education in the coming weeks. Throughout the presentation, I encourage you to type in your questions at any time, and I will begin asking them at the end of the presentation. Please note that only the presenter and I will see the questions. A certificate of attendance will be available at the end of the presentation. Simply click the yellow rightmost icon at the bottom of this presentation window when the presentation is wrapping up. So I now want to introduce our speaker. Dr. Faye Mishna is Dean and Professor at the Factor Inwantash Faculty of Social Work, University of Toronto, and is cross-appointed to the Department of Psychiatry at the University of Toronto. She holds the Margaret and Wallace McCain Family Chair in Child and Family. Prior to joining the faculty, she was Clinical Director of a Children's Mental Health Center serving children and youth with learning disabilities. She is a Fellow of the International Academy for Research in Learning Disabilities. Her research interests include bullying, traditional and cyber abuse, cyber counseling and interventions, school-based interventions for students with learning disabilities, and clinical practice. Dr. Mishna also maintains a small private practice in psychotherapy and consultation. We want to welcome Dr. Mishna to our beautiful province. Lovely weather while she's been here. Dr. Mishna is visiting the Munn School of Social Work this week and has graciously volunteered her time to be with us today. She will be speaking on her research on the informal use of technology in social work practice, of which many social workers from this province were engaged in this research. So on that note, I will now hand the virtual podium over to Dr. Mishna.
Thank you very much, and it's an honor to be here today. Thank you for having me. So the title, what I'm talking about, as Annette said, is hashtag social work, informal use of information and communication technology as an adjunct to traditional face-to-face practice. And I thought I might begin by explaining how I got involved in this. As I maintain a small private practice, and one of our hallmarks at the University of Toronto is we really like to see ourselves as informing research from practice and practice informed by research. And I was going to be away, this is about 9 years ago, I was going to be away for a few weeks, and a client with whom I worked who was quite vulnerable and needy was very worried about me going. And at that point, there was really nothing about social information communication technology. I had a BlackBerry, and she asked if she could just keep in touch while I was gone. And it wasn't meant to be therapeutic, it was just meant to be in touch. So without thinking, I just said yes. And if I had thought about it, I might have realized that this is somebody who would be too needy for that. That would be too difficult for her. So I basically opened up a black hole, and I got barraged with the BB messages, and I managed them. And then one day I was on a plane. I got off the plane, and I think I had 100 or over 100 messages, and I did not handle it well. My immediate response was to email her and say that was it. We couldn't do any more. So needless to say, we had a huge rupture, and it took many months for me to fix that rupture. I reached out to somebody I trusted to consult with me and give me some supervision on how to manage this. So in the meantime, while I was dealing with that, I was kind of horrified because in my over 20 years of being in practice and working in children's mental health with many needy and families and kids who had a lot of problems, I've never had that happen. So I spoke to a senior colleague with whom I have a lot of contact and who I really trusted, and talked about having had this happen.
Hi, Adam. Are we back? Hello? Hi, Adam. Are we back? Okay, I just heard that we're back. I do apologize. There's a little glimpse in the technology, but we're back online there now.
I'll go back a little bit because we lost some. So basically, what it made me realize is that there's nothing out there. There was nothing in the literature to help me navigate that, and that it was a different. In all my years, I'd never come across that because the boundaries were different. So I decided that it would be a good time to start to do some pilot research on it. And the reason I called it the creep is that because it's creeping in, and again, it's creeping into social work practice that is primarily or mainly face-to-face, which is different from social work practice that actually purposefully includes the technology. And I will talk about that a bit later. So the objectives for this talk, figuring this out. First is to examine the use of information and communication technology and how it's crept into traditional face-to-face clinical practice. And one of the features of it is that it creeps in so subtly that people often don't notice it. I want to also explore the benefits and associated ethical and clinical turning points. And that's important because there are many benefits as well as challenges. And to review the implications for practice and for education. But before we begin, fundamentally, this is what, at this point, we all know, but the digital age has revolutionized how individuals of all ages interact. Until a few years ago, it was more youth, but with the advent of the handheld, it's really how all individuals of all ages interact. So one of the consequences of that is that the boundaries of relationships have changed with technology. So it's no longer, if you work, it's no longer 9 to 5. And it's no longer limited by geographical boundaries. So, and the pace is staggering, and it keeps on moving very, very quickly. So one of the important features of it is that we can't quite keep up with it. So we need to try to transcend it in terms of dealing with principles. And so with the exponential increase of handheld devices, individuals of all ages use text-based communication with fluency, and they do it for social connections and entertainment, information, really practically everything. And the other thing is that communication technology has really begun to permeate how individuals seek support for a wide range of issues. So some of these are Googling, that somebody's looking up an issue, so they will Google it. But the other is really using ICT to seek help and access help. And increasingly, it's even a requirement for practice. Social work students are often asked if they have any experience with online counseling, online technology. So it's because it's really inevitable. It's really an inevitable part of the practice. So one of the issues is how do we understand it so we can deal with it in a way that's helpful. And there's some features of communication technology. One is the sheer amount of information that is publicly available is mind-boggling, and it really highlights this dramatic shift. Which is very different. And it's, again, for all ages. I mean, when we think about youth, they have unprecedented opportunities to have access and information in a way that they never did before. And the other thing is that the information a client obtains on the Internet is public. So years ago, if a client wanted to find out something about a practitioner, they really could not because it was private. Even phone numbers, home phone numbers are private, but now it's public. And the fact that it's public is important. Try to navigate this. One psychiatrist author has written that they cannot block certain aspects of their lives from patients, and they must learn to adapt to the new world that cyberspace has created. And his point here is that you can't block it because it's public. And he also goes on to say that if therapists feel invaded and they have problems with it, they kind of have to deal with it because it's very different than somebody invading your own private space. So that's, again, how it's a new world, that it's public information. So by definition, people are able to access it. And it does mean that we have less control as social workers. We have less control on the information we give out about ourselves. For example, in the past, there was often conversations about what do you put in your office. It discloses, but this is out there on the Internet. And I think this is a great example of that kind of overlapping. I'd like to speak to you for a moment, not as your psychiatrist, but as your Facebook friend. And that raises the kinds of questions that we have to deal with. So in general, ICT has transformed how professionals fields work. So this includes psychology, psychiatry, guidance counseling, health services, informatics, education, also others like law, but these are the ones that are more in the social sciences, and then, of course, social work. It's dramatic, there's constant growth and constant change. So in some ways, the transition to ICT use in therapy sessions or with social work practice seems inevitable because everybody's using it, and so it's only natural that it's going to creep in some way. And it doesn't mean there's a prescription of how we have to use it, but it does mean we have to consider how we will use it. And importantly, social workers have to be aware of the impact on the intersubjective processes between client and therapist, and that's whether it's being used or not. If the client wants to use it and the social worker says no, that will still have an impact. So either way, it's now entered the discussion. There was a time, I remember when we first started doing the study, the first study, people would say, well, I don't give up my email, I just don't go there. The problem is that time has passed because you don't have to give out your email. Your email can be accessed publicly, so you can still get that message. So we really can't ignore it. We really need to address it. And, of course, it's unique to each dyad, each agency. And it really needs to be addressed as an integral facet of the practice, even if it's not going to be used. It can't be ignored. Oops. I want to talk a bit about the benefits because often we talk about the challenges, and it's important to identify some benefits because that has to come into the conversation about what we do. So first, of course, is increased accessibility. So for somebody who lives far away, who lives in a remote place, people who are so anxious they can't leave, it really does allow a way to have access where they otherwise couldn't. And again, for social work, that's critical. It's a faster way to communicate with clients and a faster way for clients to communicate with practitioners. It can provide continuity in the therapeutic relationship and the working relationship. So between sessions, it can allow that sense of continuity, which can be very important. It can help structure upcoming sessions. So if a client emails or texts and lets the practitioner know what issues have come up that they want to deal with, and they can be prepared for that. And it can strengthen that therapeutic rapport or the working relationship because of maintaining that contact throughout the time. And importantly, there can be space for clients to reflect. Because they're writing, they can write, they can think about it, we can relook at it. They can also review what the practitioner writes. And there's a freedom to express oneself with a level of openness that is often difficult for some to tolerate in the physical presence of the practitioner. So that's really important, that there's something about being online that can be less inhibiting. And again, like everything, there can be negatives to that too, but we can talk about that a little bit later. And then, of course, there are risks. So the first one, and an important one, is maintaining confidentiality and privacy for clients and also for the practitioners. So for clients, that's critical because until the advent of the technology age, practitioners really could maintain confidentiality because everything happened in space. If something was recorded, they would keep it. And that has changed now. So even if somebody has a secure platform, if the client leaves an email on the computer, somebody else can see it. There might be somebody, if it's somebody who's, let's say, in an abusive relationship, it could be the offender. So we've lost, there's not that sense that you can actually provide full protection. And another important challenge is the shift in managing professional boundaries. Before technology, it was pretty easy to know what the working hours were, and in between, people could either call an answering service or a crisis unit, and very rarely would contact the practitioner. In fact, they would probably only contact the practitioner if the practitioner actively gave them their phone number, which wouldn't happen a whole lot. But this is different because they can actually contact them anytime. And what it fits into is the new world in which we are all contacting people and interacting 7 days a week, really all day and evening. So the question is, why would it be different with social workers? And that's the thing, it really isn't. So that's something to manage, and that's something important. And then the other is that the personal information is readily found online and it's public. So this works both ways. This is the personal information of the client. So one question is, do social workers Google their clients? We'll talk about that later. And the other is, clients can Google social workers. So in both cases, it's possible to have information. So for a social worker can have information about a client the client did not want them to have, did not tell them. So that changes the dynamics. And you also have some information that can't even say you have. And the same for the client. The social worker, some of their private information might be known to the client. And what's important is that regardless of whether it's planned or not, it now becomes part of the therapeutic exchange. And if it doesn't, it is anyway. So, for example, when I was going to school, the question was often, what if a client asks you to go for coffee? So that would get addressed. It couldn't be ignored because it was in person. So there was discussion about that and how to approach that. And now a question might be, what if a client asks you to be a Facebook friend? So some people have said they will do it because they don't feel like anybody has the right to regulate them. Others say they will not do it, and they'll either ignore them or say no. So the issue with that is, regardless of what they do, it's now part of the therapeutic exchange. So if they ignore them and don't bring it up, or if they say no and don't bring it up, either way that's problematic because the client's affected by it and it's now part of the relationship. So that's why we feel there needs to be discussion about these things. And I just want to stress that the purpose of this research is not to take a stance of we need to do this or that. The only stance is that because it's part of the world now, we need to address it and come up with solutions and guidelines, and they might be quite complex. Other challenges are inequitable use, access to ICT. One of the things we know is that the access is not equitable, and that's particularly critical as it becomes more, really more ubiquitous, so that it becomes a right. So people who don't have it are missing out on important information. And of course, the lack of nonverbal cues or feedback. That's a challenge because you cannot see the response that you're having on somebody else. And words can sometimes not do that. So those are challenges in terms of the relationship. And, of course, there's huge variations in organizational policies, which some have none. Some have none, some have nuanced ones, and some just prohibited. So the impact of ICTs in clinical practice. So what we've decided, our team has come up with 3 ways. One is the formal online ICT, and that's the standalone. That's formal, it's planned. The second is the formal blended. It's where it's both a combination of face-to-face and ICT, such as texting, message reminders. But these, again, are planned, and they're formatted, and they're structured. And the third is the one we're talking about, which is the informal, we call it intersession ICTs. And that's where the main formal approach is face-to-face, but these others are creeping in. And what's been interesting is that looking at the literature, the literature kind of talks about all 3. They don't separate them out. We thought it would be important to separate them out because they have different issues and different consequences. So the formal online, they're the standard ICT program, standalone ICT program. So, for example, e-counseling, where there's a secure platform. Telepsychiatry, psychology, we know that where there's, again, a secure platform and there's an intervention. And these, in these, the cyber communication is really the mode of intervention. That will be it, whether it's e-counseling or telepsychiatry. There are very clear protocols that talk about the interventions. It's through designated software. It's at a set time. There's a whole procedure. And there's a lot of research on this and shows that it's quite effective and that the relationship, the working relationship in many ways is equivalent to the relationship in face-to-face. But again, it's formal, it's online, and it's standalone. And this has gradually evolved as an alternative to in-person. So they're still in-person, but this, in many cases, is considered to be a viable alternative. And as I said, these online therapeutic interventions have been found to be effective. And the therapeutic relationship or alliance is found to be equivalent, which is very important. The formal blended are somewhat different. So this is where, through planned and structured format, there's an integration of both online elements with traditional face-to-face practice. But again, it's planned and it's structured, and there's protocol. So, for example, there might be planned online exercises that are implemented to replace or supplement some face-to-face sessions. And it's guided and monitored by the practitioner. And both the online and face-to-face are considered to be the nature of the intervention. And some examples of online elements include journaling, email reminders, text message monitoring, psychoeducational activities, or administration of assessment and testing instruments. And there's a fair amount of research on that too. Now the third one, which is the one that there's been very, very little or almost no research on it, is the one we're talking about. It's how ICTs have entered practice through informal and often unpredictable and unsanctioned and unwanted use. So often the practitioner might not want it, but it is directed by the client and it comes into the face-to-face session. And it happens typically between, but it can also happen within sessions. So, for example, somebody can be in a session, somebody can text them or somebody else. And it's very important to remember that the way this differs is the primary and the formal modality is face-to-face, and that's all that's been planned. So when these are used in conjunction with face-to-face, it can either be synchronous or asynchronous. It can be email or texting, but it's not meant to replace face-to-face practice, and it's actually not. It hasn't even been planned to be an adjunct. It just becomes so. And the interactions range from very practical, for example, scheduling appointments, and most practitioners probably don't have a problem with that, but it can range from that to complex issues such as communicating intense distress or updates on clinical and critical incidents, even expressing states like being suicidal. So it can become quite complex therapeutically, and again, it has not been planned. So, regard to this third one, the informal intercession, we've thought that there are three frameworks that we feel can help understand and kind of help us understand how to look at it. The first is ecological systems framework, which we know is central to social work practice. The second is a technological acceptance model, which I'll explain. And the third is the concept of the working relationship, which we all in social work know is absolutely critical. So I don't have to say much about the ecological systems framework, except it incorporates the reciprocal contributions of the different levels of a person's environment. And it situates the individuals in a social and environmental context and recognizes the various and nuanced levels influencing behavior. So the piece that's important about ICT is that more recently, some researchers have adapted ICTs into this system in order to keep pace with this new world. So it really recognizes that when you talk about the person and environment or the ecological systems, you cannot exclude cyber. So some researchers have added them, and it's a techno subsystem proposed. And it's been added in different ways. Some have placed this into where the individual is at the core, and others have placed it at the outer ring. And I think that's still something that needs a lot of discussion. One of the things that we have been talking about is, in a way, it kind of runs right through it. But what's important is it now has to be recognized for two things. One is in doing assessments, when we think what's affecting a person, we need to look at how cyber is affecting them and interacting with other parts of the world. But the other is cyber now comes into the relationship with the practitioner, regardless of how. So the technological acceptance model, that really understands, it helps us understand the attitudes towards an adoption of technology in professionals' contexts. So, the theory behind that is that there's greater utilization of ICTs, especially mobiles, that are driven by two factors. The first is the perceived usefulness of it, and the second is the perceived ease of use by both therapists and clients. So it's really, the bottom line is, do the benefits of ICTs in practice outweigh the effort by therapists to use them? And so really how ICTs are encouraged or discouraged by societal and organization norms and perspectives of therapists, clients, and administrators. So we look over the last few years, there's been a shift because the effort to use it now has become almost zero, and the acceptance throughout the world is greater and greater. So that's an important context to take into account, because we think, given that, how do we then not use it? And given that, how do we make sure it's used in a proper way? And then, of course, there's a working relationship, which is considered central to social work. And, in fact, there's evidence from all fields that the working relationship is the most crucial determinant of client outcomes. And so one of the major tenets of social work is start where the client is. So what if the client is wanting to use that? Doesn't mean we have to use it, but it's a question that needs to be examined. And with the exponential use of ICTs, especially handheld, we really need to consider how the working relationship has been adapted and affected, because of course it has been. And again, it's not saying we have to do one or the other, but we need to understand it. And research on both the formal blended and the formal show that it's been effective. There's no research on integrating it informally, and to understand it is very different than looking at how it's integrated formally. So we feel that there really needs to be research on that, which can help inform us. And I would say over the last few years, there's evidence that there's a great increase in the use of cyber communication among professions, even when cyber communication is not the primary mode of treatment. So that's hence the crept. It's crept in, even if it's not the main mode. And that regardless of whether it's wanted or not, it does offer benefits and raises challenges. And as I mentioned, there's a lack of research. So basically, just that the research shows that informal have been beneficial. So we decided to study the creep. And my co-investigators are Marian Bogo, Dan Root, Lynn Fang. And so it began in 2009. And what we started to look at was really how cyber technology is creeping in. And we've had 3 phases. So started, really went from 2009 to 2013 as a qualitative analysis. And then we have a current study that's funded by SHRC, but I'll go into that a little bit later. And I'll just briefly describe the creep. So for the 3 phases, there were a total of 42 participants, and we did theoretical sampling because we wanted to capture variety, more females than males. And the age range was from mid-20s to mid-60s. We began with the older ones, but I'll explain that. The criteria was that they had to hold an MSW degree and to be practicing social workers or administrators. And the practice experience turned out to be from 2 to over 20 years. And we received U of T ethics approval. So the initial conclusion was that ICTs, and these are people who, many of them came to the interview saying that they actually didn't think it had affected them at all, but that they were interested in the topic because they had not really thought about it. But in speaking, they started to think about ways that it actually had begun to creep in. So our conclusion was that ICTs really have revolutionized communication between practitioners and clients, and that they've and therefore have dramatically impacted even traditional face-to-face therapy and practitioner. And the elements of practice that we found that were affected were the boundaries, the time and space, because of when these communications would take place, the disclosure of information, both practitioners and clients, the working relationship, and the ethical and legal issues and dilemmas, and of course policies and procedures. So our initial conclusion, which was a bit of a surprise for us because we really thought there would be an impact, but we felt it was that it not only had crept in, but that it really signified a turning point that had not yet been recognized. And at the time there was some literature on it, and the literature was really more about, advice and identification of challenges and ethical issues. And much of the literature talked about how it was important not to engage informally. But this was at odds with what we found was actually happening. So the findings, there are 4 major themes that have emerged from the first phases. The first was client-driven practice. Basically what that meant was that the practice was driven by the clients. It was the clients who initiated the contact. And the practitioners were often not very happy with it or comfortable with it and didn't know what to do with it and had not thought about it. The second was a Pandora's box. They were scared to open it up. They were scared to respond because they were scared they wouldn't be able to put that back in. And I can relate to that because that's what happened to me with my example, where when I felt it was too much, I tried to go back to what it had been before, and it took a while for me to realize we couldn't. We'd already gone forward, so we had to figure out a different way. The third is the ethical gray zone, where there's ethical issues that they just had to grapple with. And the fourth was, of course, the permeable boundaries, that the boundaries that had existed had now stretched. And there's been much discussion over the years, I think, about how we need to keep the boundaries, and there's also discussion about how often now there are no boundaries and no privacy because of social media. And our findings suggest otherwise, that the boundaries have stretched, and in some ways, how can they not stretch? Even in social work, because they've stretched everywhere. But that doesn't mean there are no boundaries, and it doesn't mean we can't control boundaries. And also doesn't mean there's no privacy or confidentiality. What it does mean is that there's a realigning of what boundaries are like and what privacy is like because of social media and communication technology, but that doesn't mean there's none. It does mean we need to engage in a conversation about it. So 3 years later, and what we did is the original criteria, we just coincidentally ended up with a number of practitioners who had been out for a number of years and were, I think, over 35 years old. And when we presented the information of the feedback, somebody pointed out that we didn't have any young and inexperienced practitioners who might have a totally different reaction because of their relationship to social media because they had never not known it. So we interviewed new practitioners, and by then, because it was 3 years later and handhelds had really taken hold, we thought, well, so if there's a difference, is that because they're younger or is that because it's 3 years later? So we decided to re-interview the original participants. And what we found is that social work practice had transformed in those 3 years. And the major theme was from reaction to intentional use. So as I mentioned before, 3 years before, we found that it was the clients reaching out and the practitioners were just reactive, and they were not anticipating it. Now what was different is they had engaged in reflective practice, which really led them to learning what works and what doesn't work. Now what was interesting is they didn't have literature to guide them, so they kind of did it on their own, which is one of the reasons we also think it's important to have research and literature to guide, because they knew to expect it, this was going to happen, and they had to figure out a way to deal with it. So some of the things they talked about 3 years later was I needed to educate my instincts. My instincts were to say no, but I had to educate them. I had to learn how to shift with the times. How is this meaningful to clients? What is this going to mean in terms of the impact on my personal life? And how can I figure out what works? So really it was, so in terms of the themes, I'll just go through them briefly. They're comparable to the ones before, but in a different way. So in terms of the client-driven, I'll just go back for a second. In terms of the client-driven practice, even though it was still client-driven in some ways, the practitioners had come to two things. They'd come to recognize that they should anticipate this. So they prepared the client to say, if you send me an email, if you send me a text, this is my policy about it. This is how I'll work with it. So some might say, I will read them, I'll print them out, and then we'll bring it up when I see you. Others might say I might respond, but it might take a few days. So they were clear on that and had to say that many times over time. And then the other thing they did was they prepared the client initially when they, similar to when practitioners see clients and will say something like, everything you tell me is confidential except unless there's circumstances, and then they explain the circumstances that lead me to have to go to the authorities. They added something. What they added is, and if you email me or you text me, this is what you can expect from me. So they were anticipating it. And go through them here. So therefore, they recognized the therapeutic effects of cyber communication because they were less reactive and feeling like they had to respond. So one was the continuity of sessions. They saw that sometimes it provided continuity, but they no longer felt they had to react right away. It was really depending on what they felt they could do, but they could get the information and understand that contact was helpful for the client. They also came to realize that when the client emailed them things that were happening or things on their mind, that would help them prepare an agenda that was current. Another important factor that they recognize is that it can maintain the relationship. Just for some clients, is knowing they could connect with the practitioner and the practitioner would be hearing them, even if they didn't get back to them, that would be helpful. And it could also help them self-regulate because they could be able to share it, and once they've shared it, they know somebody else is kind of hanging on with them or hanging on to it with them. And again, some of them would respond more or less, but this is deliberate, more deliberate. And they also found that with kids, like adolescents who might be hard to engage, so it was very helpful to slowly engage the adolescents. The other benefit was the writing and sharing, that for some people being able to write and share was very important because they could vent their feelings, knowing it was out there and knowing that somebody had it, whether they talked about it or not. So they really recognized a number of benefits, which they hadn't before because they were so reactive. The second theme, and this goes to the boundaries, addressing boundaries in the ever-changing digital world. So they totally recognized the boundaries would change, but they didn't feel that meant there could be no boundaries. So they had these initial discussions about what the boundaries would be, and that they would expect them to be contacted by ICT, but they would give an expectation when they could respond. An important piece is that sometimes in the literature it would say, these are the things to set out, let them know you won't respond, or let them know this. And what the practitioners in this study told us is they often had to repeat it many times. The other thing some of them did is they separated their email and Facebook into work and personnel. So, for example, one young man who was working with a group of teenagers, they wanted a Facebook. So what he did is he set up a work Facebook, and he was available on that, made it very clear when he was available on that and what the content was. So the young and the new, one of the questions was, are the more experienced ones different from the young and the new ones? And we found in some ways they were, in some ways they weren't. The young and new ones, they understood the benefits of ICT intuitively, so they could seamlessly integrate it, and they tended to feel that they're responding to the client would be like if the client responds at 11 o'clock in the evening, well, we should respond then, because that was part of how they operated. But again, this was not all of them. This was some of them. And administrators that we interviewed, they understood that they were in a dilemma, that it was hard to develop policies. They wanted them to be nuanced, and they wanted to allow practitioners to be flexible, but also to have their back and realize that they need protection, because if they're working 24 hours a day, 7 days a week, they're not getting paid for that, and they're not getting, they just could burn out. So the ethical gray zone, the difference here is they were more aware of what it was. So the variation in agency policies, and some talked about also having variation in practice with other professionals that they were engaging with, that some would send them very personal information about the client, so they had to sort that out. The other important change was now, rather than just being worried about it, they sometimes talked about educating their clients about the potential vulnerability due to the lack of confidentiality. So one person said, I'm ever increasingly mindful of my responsibility to be concerned about client vulnerability in this aspect of it. So they would talk to them about it, so it wasn't just up to them to protect them, but them to help educate them. And back to the young and new practitioners. So some of, as I mentioned, some of them approached it differently than the experienced ones, because they felt it was easy access and it didn't matter when, you just need to respond to when the client was. So they seamlessly integrated it. They also talked about social justice, and they were very aware of the lack of equity in terms of access, and they thought that was something really important. On the other hand, other of the young ones and new practitioners, precisely because they understood it so well, they really understood the challenges. They understood how vulnerable, exposed, and how unsafe it can be if you're not careful. So it was really interesting. They went both ways. So they valued it, but they were cautious. So one person said it makes it a little bit stickier to keep professional boundaries. So they were very aware of that and the need to figure out how to do that, but also to be responsive. And they stressed the importance of the transparency about where the boundaries would be. So similar to the other experienced practitioners at this phase, they said it was very important to let the clients know. So it's really important. So I guess the big change was that it was up to the practitioners to take the lead in that conversation. And the reason I think this is all very important is if it's not being discussed among us in education or in our meetings, then we're not helping practitioners to do that. So they would make it clear that they're only available through office hours. And they also wanted the agencies to provide after-hours services, because one of the issues that came up over and over again is that if there are not after-hours services, then clients automatically often contact the practitioner who is in a dilemma. In one of the focus groups, the person talked about on a Friday night being out for dinner, and a teenager that she worked with in the school board who wasn't very talkative he texted her to tell her that he was feeling suicidal. She didn't know what to do. She felt very conflicted, but in the end she did contact the father and got them to get together. But again, this is a Friday night and brings up those kinds of issues of how to deal with it. And again, I keep stressing that at this stage our feeling is that we don't have a yes or a no. We just our position is we need to look at it. And the executive directors, again, recognize the ascending world, and they wanted to support practitioners and allow them to be flexible, but also not to, and definitely to have limits. And one of them said, at the end of the day, clinicians will do what they believe is right for the client and for the practice, not what the organization tells them to do. And what's important about that came out was the policies need to be realistic, because if we just have policies that prohibit, we don't want practitioners to be in a position where they do it and engage. This has always been an issue in social work, because if they do and then they get in trouble, the problem is where do they go? So the question is how to set the limits, have the guidelines, make that clear, and yet leave the door open so that if somebody is in trouble, they can come and speak. And that's a very fine line. So our conclusions were that practitioners are beginning to tailor their own technology-informed practices, which is great, but they're doing it on their own. We're not having these broad conversations, and we need to be. And that really, it's not whether to use it or not, it's how to use technology effectively and responsibly. And it will vary for every person, but really the days are gone when somebody can say, I don't have email, you can't contact me, because any of us can be contacted. And also we need to be aware of policies, particular web-based services. So for example, Skype, that's an interesting one, because their terms of reference are that they can monitor and they keep recordings. So that means it's really out of practitioners' hands, and I'm not sure that clients know that. And even though realistically the odds are very slight that they will look at it, but it is possible they could look at a recording and be worried about somebody because they're not practitioners and do something with it. But importantly, the confidentiality doesn't remain with social work. And then in the States, Skype is not compliant or wasn't compliant, so social workers are not allowed to use them. So those are the kinds of things that, again, we need to be aware of. And some practitioners have said, well, they told their clients, and their clients said, that's fine. But again, we know, is it really truly informed consent? If somebody feels they don't have a choice, do they really understand the consequences? So we found that, again, with the experienced and the new practitioners, some of them adjust differently and some adjust similarly. And part of that is because more and more people are using it. And another conclusion is that it's not feasible to adopt and maintain a policy that prohibits cyber communication with clients. It has to be more nuanced, and that just prohibition won't work. And by creeping into practice, information and communication technologies have really extended the boundaries between social work and the client, and that's inevitable. That doesn't mean there are no boundaries, but it also means social work is like everything else. Those boundaries have been extended, so we must deal with that, because it does not mean there's no boundaries, but it means they're not the same kinds of boundaries. So therefore, we believe strongly that the responsible position is to examine and understand the consequences and implications in order to inform practitioner behavior. So I just want to briefly mention this study. It's funded by SHIRK, and it's hashtag social work, informal use of information and communication technology as an adjunct to traditional face-to-face practice. It's a mixed method study, and there's two phases. The first phase is an online survey, and it was administered to social workers in Canada, the U.S., and Israel, and now England is going to administer some. So that's great because we have an opportunity to compare. The questions were related to the frequency, nature, and scope of informal intersession ICTs in traditional face-to-face practice. And the second will be semi-structured interviews with social workers and clients in a number of agencies, and it's to investigate the impact of these this informal session on face-to-face practice and its influence on the working relationship. So we don't really know what's the effect of it, because how helpful is it? How helpful is it not? So I just have some preliminary findings. So it was, in Canada, we had over 3,000, just over 3,000 participants, about 1,300 in the States and 326 in Israel. So altogether we have 4,600 participants, and we should be getting some more from England. And one preliminary finding is that 77% of the participants who filled the survey out said they use ICTs to interact with clients between regular scheduled sessions. And the AAPCSW is the Clinical Social Work Association in the States, and they said it was 90%. But one of the things we want to find out in the research, and we'll find out a bit more when we dig into the surveys, is what does this look like? But 77% is quite high. And 90% said that ICT has caused no difficulties. And 95% will continue to interact. And so, again, that's one of the things we want to look into, because sometimes people say there's no difficulties, but then when you delve into it, you might see what's happening. And another question was, the interaction with the client through ICTs outside of their regularly scheduled work hours. Over 50% of Canadian respondents said they do, so that's outside of work hours. Over 80% of American and Israeli respondents, and that's interesting because we don't know why the difference, so that might be something we can look at. Another question we asked is, how many searched for publicly available online information about a client? 42% did. The most often identified reason was to gather additional assessment information. And 80% are not comfortable with a client being able to access their online personal information. So this is clearly an area that needs to have a lot of discussion. When it comes to searching for a client, it means that we're getting information that they might not have shared with us, they might not want us to have, and they may not know we have if we're not transparent about it. So as social workers, we all understand that having that information, even if we don't talk about it, still is in there. It's influencing our relationship somehow. It influences the transparency, so it's changed something. So that's an important area that we will look into. Less than 50% were aware of policies in their workplace. So that means over 50% do not know if there's a policy in their workplace. So they're kind of doing it on their own. And I'll just show a bit of the provinces. So I just want to say Newfoundland is here. So Newfoundland, we got a huge response from, so we really are appreciative of that. So you can see we had quite a range. But overall, I think we have a good response. But I want to thank Newfoundland and Labrador. And what age group? We see pretty much it's across the board, so that's very interesting too. And the geographical locations, mainly urban and suburban, rural, and then remote. So it's not a surprise, but it'll be interesting to see if we can compare those. And how often do they interact with clients through email? So the first one is rarely, and then this is none, and then rarely. But these three are more often. So when you add these up, it's significant enough to look at, to see what's going on. And that would be just, the different kinds of email, text. And what their roles were. So the roles include counseling, therapy, case management. So there's, again, a whole range of roles, and we would like to look into that. And then the National Association, again, these are all the states, so there's a big range. And again, some states we got a lot, some less, and same as in Israel. So we are in the midst of, right now we're doing more analysis on our data so we can have more finalized data, and we're just starting to prepare our ethics protocol to do the questionnaires, and they will be informed in part by the results of the data, the surveys. So that's it. Thank you.
Wow, thank you so much for this very interesting presentation. So we have arrived at our question and answer period, and and we will do our best to get through the questions. So if you can send in your questions now, that would be great. I guess just to start us off, Dr. Mishna, the slide you had represented the 42% search for publicly available information to inform their assessment. Was there space on the interview questionnaire of whether that was something that they had told the clients about or not?
It's a good question. I can't quite remember. I think we did have a question about whether they were concerned about that, whether they felt that was problematic or not. But I don't remember.
No, that's perfect. Just a question around personal and professional boundaries and how we might maintain personal and professional boundaries when using information and communication technology in our own practices. So you spoke about some of this in the presentation around clients not expecting you be available 24/7, and also in terms of our self-care. So any tips on how we can maintain those personal and professional boundaries?
I think it's a tough one. I think the best way is probably to really be clear in stating it and maybe even writing it out and just reminding people of it so that they know that and that we keep examining it and doing it in a way that's not just a rule, but just having a discussion. But I think it needs to be stated. I know recently at the University of Toronto, the privacy person said that until recently there was an expectation that people should keep personal and professional emails, but because of the accumulation of information and the back and forthing, that they now don't expect that even. So I think the reality is it's gotten much more complicated because it all gets blurred. So I think the best thing is to kind of consider what works, and it might be different for different clients, and that's why I think it's important to have discussions, but also so really to make it clear and to keep going back and revisiting it. It's not really a one-shot message.
Thank you. One of the concepts that's come up in the literature is around e-professionalism. And how one portrays their professional self online, and certainly an emerging concept. Can you speak about this based on your work in the area as it results to informal use of information and communication technology? Just ask for some clarification here. In terms of maintaining that professional lens, so I guess going back to some of the personal and professional boundaries, how do you maintain that professional presence when you're using informal technology? It could even be, around social media. How do we look at that whole professional identification online?
Well, I think it's a great question, and I actually think that as practitioners, we need to really be aware of that, especially knowing that it's public. So, for example, one of the things that we do when students are oriented, we talk to them about the fact that now that they've been a student, because our school is only graduate, but now that they're an MSW student who's going to be doing practicum placements, they're no longer just a student, they're also a professional, and that you really need to be aware of that. And I think that it's something we just need to be responsible for, that we need to be aware that it will be seen and it will be known. And so we need to be comfortable with the fact that somebody might know that and that's going to influence them. So it's one of our responsibilities to our profession. And I guess I don't know whether it's ever going to be shifted into the code of ethics, but I think that it becomes a very important area because we can't just separate it.
Wonderful, thank you. I have a question here. If a client has posted things on Facebook publicly that are at odds with their reports during a session, how does one address this with the client? And how does this change for mandated versus non-mandated clients? For example, if an individual is mandated to attend counseling, say for drugs or alcohol, and states that they're abstinent, but then on their Facebook account they have a status that an update that would state otherwise, how do you kind of reconcile some of that with the client?
I think this is a really tricky and very important question. I don't know that it's been addressed. I think there is a difference between mandated and non-mandated. I guess one of the questions that's come up before is how much are you transparent? Does the client know you're going on to Facebook? So there's two parts to that. One is if you are transparent, then they know that you're going to be seeing it. Then you can discuss it. The other is a concern that if you tell them you're going to be, they might not put it on, and so you won't know it. With some clients, I think it's pretty straightforward. I know I've worked with teenagers, and I'm sure many have, where that comes up as an issue, and so then we actually go into their Facebook or their Instagram and kind of look at it and see the message. So that's one way. I think when we're going to Google them and we have the information, I think we have to be very careful. And I don't know that we have all the answers yet about that. I think that's one of the things that we need to really determine. Because if we don't tell them, particularly whether it's mandated or not, that definitely affects the relationship. But on the other hand, if it's mandated and it's a safety issue, we might be determined that it's for just cause. So I think it's really something that needs to be discussed, because the fact that it's public doesn't make it okay without talking about it. And if we do have the information and don't talk about it, it's definitely still affecting the relationship.
Thank you. Another participant says, great presentation. It seems that today's clinician being proactive is key. For example, if a client has our telephone number, we should anticipate that we may get a text, and if we don't, to clarify that. So it's proactive to raise this topic up front, correct?
Yes. Absolutely. That was one of our biggest findings, that we found that practitioners started to do that. And I think if you do it that way, then you can explain it, and it doesn't become personal. If we don't do it that way and somebody calls us and then or texts us and then we don't want to respond, then it causes another issue. But if it's really presented as that's just what to be expected, and and even if they text to say, I will get back to, I'll bring it up when we meet, or whatever. So I think that's really critical, so that it becomes part of it. And again, I think it needs to be brought up over and over again as needed.
Thank you. One of the interesting points you raised was around clients searching information on social workers. Did your study, or even from your research that you've done and in the literature, highlight any points around professional self-disclosure and the risks and things associated with that in terms of what clients can find out about social workers online?
It hasn't, and I think that's an area that's lacking. Some of the literature just says be sure that you don't post anything, but again, the don't posting makes it difficult. And Glenn Gabbard, he talks a lot about that, saying whatever you post, it is public, so you have to deal with that. But I do think there needs to be more about that, because we need to recognize that if we post, and what we post is public, and that's going to affect clients. So I think that's one of the areas that we really need to discuss more, rather than just having a do or don't. And of course, practitioners who've had difficulties, their concern there is that's going to show up first. So it's just really something we need to be aware of.
Perfect, thank you. And keep your questions coming. We still have some time. Do you think that social workers should have their own social media policy that they share with clients at the onset of professional relationship? And if so, what might be some elements to include in that?
I think what would be great is for the social work policy to fit with the code of ethics and standards and policies, so that if we don't have too many separate ones, because otherwise 10 social workers, we're going to have 10 policies. So I think that's important for it to be looked at. I also think the policies need to be broader than specific, because one of the issues that we know about technology is it changes so quickly. So if we make it specific to the technology, it will be defunct. It will be irrelevant within a very short time. But I do think the policies need to be around accessibility and availability, how it will be used, and when you will be looking at it. So those kinds of issues. But I think they have to be figured out how to be fairly general. And then there's others. I don't know the answer to if you see an email on a Thursday night or a Friday night and it's a problem. Those are ethical issues that we need to deal with, because if we've seen it, we've seen it. And if we know somebody's in trouble, it's different than in the past when we didn't. So I think those are things that as a field we really have to grapple with. But so I do think it's important to have policies, but I think it would be problematic for social workers to have their own individual policies. And one of the things that we found is that these social workers were doing that, and I think it was helpful. But one of the problems is they were doing that because there wasn't any other guidance for them. And I mean, now they're starting to be more. But I think it's important that we all really engage in that.
Thank you. Still some time if people want to ask some more questions. If not, we'll look at concluding fairly shortly. Are there anything, other risk management strategies that you would identify from the literature in terms of how do we navigate some of this gray? You mentioned about the Skype and how that information is recorded, and the onus that's responsibility that social workers have to ensure they have knowledge about how these communication technology platforms operate, and what are some of the risks and challenges with those?
I think that's very important. We really need to be aware of that and when not to use something. I also think it's really important, like with anything, that practitioners have people they can speak with about it, that they have mentors, peer supervision, supervisors, because whenever we're private or alone with something, we're more at risk, especially with something that's got that ethical gray zone and it's not really clear. So I think that's absolutely critical, that be open discussion about it, so that they're getting advice, discussion, bouncing it off to figure out what is happening, and so it can be reviewed. I really think that's important, because I think just doing it on our own, it's very easy to lose sight of the overall pictures, and even to feel pressured if the client's in trouble or something like that. So I think that's critical, and we really do need to know the policies of these places. The other thing we need to know are things like insurance. So somebody's in Newfoundland, let's say, and somebody's Skyping you, or not Skyping you, but even emailing you and talking to you from Ontario, what is insurance policy with that? What's the liability? Those are all the kinds of things we need to know. But I think it's really important that we have the discussion open, because one of the things that I have found is that when I've given this presentation to different places, sometimes practitioners, even really experienced practitioners, will come up and say to us that they've been doing it, but they don't want to talk to anybody about it because they're scared they're going to get into trouble. So we want to break that. We want people to be able to talk about it so it doesn't become a dark, hidden secret, because it really is something we all have to grapple with, and I think that's really critical.
Just a couple more questions. Was there one type of informal communication technology that was being used over another? Did the research show that? Was it more email, texting?
We haven't analyzed that enough yet, so we're still in preliminary analysis, but we will have that information.
Another question here from someone online. When social workers are moving between roles and positions, do you think it might be hard for them to disengage themselves from the clients who they've been connecting with via text, email, social media, and how that might impact on boundaries?
I think that's a great question, and absolutely it would, because the contact is kind of transcends the physical space. So it means that they would need to really prepare that, and again, if even have a weaning off period, or if they were going to say, if you get in touch with me, which is what they can expect and how that will happen. Because if it's not done in a planned way, the contact will inevitably continue. So I think that's the kind of thing that we have to deal with now. We always had to deal with that in a different way, but there wasn't an automatic contact afterwards. So I think that's really important.
I guess it really relates to the termination of the social worker-client relationship piece. And even, I'll pass you back over.
And then in some cases, I think there are some cases where, I know I've had that, where it's terminated and there isn't ongoing, but every once in a while the client would just get in touch just to give an update. So again, it depends on the situation, because I think sometimes that can work and that's not problematic. But that has to really be assessed. And again, I think it's important that somebody else be in part of that discussion, so it's not your own private kind of secret.
Yes, which relates to a question around going back to the 42% of people who search for public information about their clients. Was there any indication from the study of how people are documenting that?
We don't have that yet, but we're going to be compiling that. And that's a really great question. That's one of the questions. If we don't get that from the survey, that's the kind of question we'll ask in person. Really critical, because they may or may not be documenting. It might be to something they're doing on their own.
All very interesting, yes. I don't see any more questions coming in from folks online, so I'll just give it another second. And no additional questions coming in. It was a great dialogue for sure. So I guess I just want to take this opportunity to thank Dr. Mishna for this wonderful presentation and for sharing your knowledge and research with us here today. Really excited to read about the study and the future work that you're going to be doing around this very important topic. And you've certainly given us a lot to think about, from the practicalities to the ethical considerations that we need to be thinking about and discussing in terms of how technology interfaces with social work practice, and also to learn from each other in terms of what we're doing. And I believe that every time we're able to come together to explore these kinds of issues, it does provide that context for continued learning and reflection, which is so important. So thank you for being with us here today. It's truly appreciated. And I believe yesterday it was noted that this was your first time to Newfoundland and Labrador, and her comment is that she loves it. So we're so grateful to have you here today and be able to do this presentation for social workers across Newfoundland and Labrador. So thank you again. Just in conclusion, the recording of this presentation and the slides will be uploaded to our website for your reference. And there's lots of articles, too, that Dr. Mishna will send along to us, 3 articles that we can also include. And all of our practice resources that we develop here through NLASW, such as our Ethical Decision-Making Resource Tool, the NLASW Standards for Technology Use in Social Work Practice, the CASW document on social media use in social work practice, and the model regulatory standards that were produced by the Association of Social Work Boards are also all available on our website. And you can also find publications related to the topic in our Practice Matters series and in our continuing education site on the website and in our Connecting Voices social work newsletter. So on that note, I thank everyone for attending this afternoon, and enjoy the rest of your day. And there should be a yellow button come up there shortly in terms at the bottom of your bottom right of your window that you can use to download your certificate if you choose to do that. And we thank you for engaging in this discussion today. And I guess we'll sign off now. All right. Thank you, everyone.